Sudden infant death syndrome, popularly known as SIDS, sudden infant death syndrome. It is also known as cot death in Britain and crib death in North America. Cot death or crib death. It is a short note, maybe for 2-3 marks, rarely 5 marks. What is the definition of sudden infant death syndrome? Name itself has mentioned sudden death. Name itself mentioned infant. Okay. Sudden infant death syndrome is the sudden and unexplained death of a baby younger than 1 year. Younger than 1 year old, and in whom a thorough necropsy fails to demonstrate an adequate cause of death. That means totally unexpected death of a baby within 1 year without any predisposing factors. Even after postmortem examination, doctor cannot opine about the cause of death. Say some books say up to 2 years, but see the name. Name itself says sudden infant death syndrome. So it should be 1 year. Okay. What are the features? What are the features of sudden infant death syndrome? Incidence is about 0.6 per 1000 live births. 0.6 per 1000 live birth. Sex, slight increase in case of male child. Okay. Boys are slightly more likely to die of sudden infant death syndrome. Each, as I said, some book mentioned, they say maybe 2 weeks to 2 years, but peak is 2 to 4 months. Okay. See, that's what I said. Even though the name is sudden infant death syndrome, I want to put in my definition that it is in a less than 1 year. But generally they say that even after 1 year also it may take place. But strictly speaking, if 1.5 year baby dies suddenly, we can't use the word sudden infant death syndrome because it is not an infant. Infant means age less than 1 year. Race. Non-white infants are more likely to develop sudden infant death syndrome. Non-white infants. Family history. Babies who have had siblings or cousins die of SIDS are at higher risk of sudden infant death syndrome. That means if the parents have only one child, see all these I don't believe personally. They just go for some statistics. Many times, many people may have more than one child and they may die of sudden infant death syndrome. Then they say it is more common who is having siblings. I don't know what the relation between the number of siblings as well as sudden infant death syndrome. Second-hand smoke, passive smokers. Babies who live with smokers have a higher risk of sudden infant death syndrome. So, for example, I am a smoker. My baby is in my house. Always I smoke at home. Such babies, chances are more to suffer from sudden infant death syndrome rather than a non-smoker father or mother. Okay. Prematurity and low birth weight increase incident. Premature babies are prone for sudden infant death syndrome. Season. It is seen higher during winter than summer. Okay.